Well, I'd like to really thank you for inviting me to be part of this day. This is one of my favourite days of the calendar. And I also want to thank Andy for inviting me into your course, really, because for the last 3 or 4 sets of a particular third-year module, I've been teaching an afternoon about critical psychiatry and the history of anti-psychiatry. And I have really enjoyed myself, and I've learnt a lot from you, and you've been absolutely great towards me, and it's been great. So let me just introduce myself. I qualified in 2000, and I worked in acute and then in a number of community teams. 2010, I did a master's over at Warwick, and that was called The Philosophy and Ethics of Mental Health. And then, after a bit more time in work, I started doing a PhD here, and I'm now in my 3rd year, so I've nearly finished. But before anybody says anything, I am not the PhD person that Peter described this morning. I'm a nurse. I'm going to stay a nurse. When I first told the trust that I was working in that I was going to be doing a PhD, they said, oh, well, you do know you won't be able to describe yourself as a doctor, you know. And nothing could be further from my mind. In fact, I find the word nurse too much of a barrier a lot of the time. So I'm definitely a nurse. I'm returning to nursing. I'm not going to tell you more about my PhD. I'm going to tell you about some research that I'm doing with some of you. But before I do that, I can't resist this opportunity to say 1 or 2 things. I always enjoy hearing what Peter has to say. I did again this morning. And I just want to say to you, and you may well know everything I'm going to say, that you're graduating at a confusing and exciting time. Basically, the DSM has collapsed. Even they say so. And with it goes much of what psychiatrists refer to as their evidence base and the source of their legal authority. And they're now operating in a space which is more about because we don't know what's next, rather than because they have any legitimacy. And some people have even gone as far as to describe the profession as the living dead. It's now acknowledged that the idea of mental illness caused by a chemical imbalance in the brain was only ever a metaphor. Survivor groups tell us that they can understand their psychosis now in new ways that are very different from the norms of mainstream psychiatry, mental health services, and that are liberating for them and that provide them with a future. And this phrase, critical psychiatry, is gaining a credence, and psychiatrists are calling for a change in the way that their profession understands personal experience, and the scope of the idea of illness to help us understand distress is under question, but they still want to be in charge. The British Psychological Society last November released a document called Understanding Psychosis, and for those that have studied psychiatry will know that that very phrase in itself, understanding psychosis, is deliberately controversial. There's a growing movement which is critical of psychology, which notes that along with psychiatry, societal problems may be located within individuals who, through a variety of deceptions, may be made responsible for an increasingly unequal society in which the suffering of ordinary people is said to be down to an epidemic of illness, their lack of resilience, rather than injustice and exploitation. Maybe psychology just replaces bad brains with wrong thoughts. Suicide is the leading cause of death in young men now, while the top 1% of wealth tell us that we can't have the free healthcare and the free education that our grandparents won. They run it down, then they rubbish it, and then they sell it to their mates. Just like we're told that war is caused by the existence of something called evil that must be bombed out of existence, all dissent from the capitalist machine and the distress caused by it is due to something called mental illness, and we must obliterate it with drugs. Suddenly it feels that to understand the world that we have, you have to become as paranoid as the people that we're locking up, and it feels that you can't follow the news and remain mentally stable. These are just some of the conflicting views that are part of the context that you're graduating into. Health journalists have also led a campaign of public awareness, revealing the ways in which big pharmaceutical companies, second only to arms manufacturers in wealth, have shaped our understanding of distress and made trillions of dollars. One of the heads of the Cochrane Institute has recently described their role in psychiatry as organised crime. So who knows what the truth of the matter is? Peter told us this morning that nurses see themselves as required to be reliable, flexible and submissive. You know, I didn't come into nursing to be someone's puppy. He said that nurses feel that they're supposed to have a professional identity dependent on being autonomous and satisfied. Does that mean that we dance to the tune of the targets and we like it? And this is the world that you'll be nursing. What's it going to be like? When people come to you in distress, what will you tell them? The chemical imbalance again? Are you going to try to explain about the effects of inequality in society at that moment? That psychiatric knowledge is contested, that one discipline's evidence base is another's propaganda. Who is taking a lead in the MDT meeting? What explanations for distress will be touted in the ward round, and whom will they suit? The only certainty is that when it comes to explanations, the more certain someone sounds, the more easily they can be shown to be poorly read. So what are we doing about it? And this is what I've come to tell you about. So a group of us, myself and 4 of you students, well, 2 have just recently qualified, have got together, and we are calling ourselves the BCU and Beyond Research Group. And we're doing a piece of qualitative research. We're looking at the experiences of student nurses with an interest in critical ideas of psychiatry, leaving and becoming qualified professional nurses. We're going to be interviewing them at 6 months after they've qualified, finding out what their experience has been of taking those kinds of ideas and questions, and yet also becoming a team player, about fitting in with their trust policies and upholding their duties as a nurse. What are they learning about how these ideas work in practice? How does their experience fit with the literature about these kinds of conflicts? What are the challenging moments? When do they notice the conceptual conflict the most? How have they dealt with it? What do they think that their service users have experienced by way of these conflicts? And what was that like? So, we've got Samantha Vaines and Simon Farnworth, his name is. They have both qualified, they've both got jobs now. They were in the first lot of people that I was lucky to teach on this subject, and they will be coming up to 6 months and the time to interview them in just in a couple of months' time. We've got Julia Hancock, who's in one of the cohorts that's going to be qualifying, I think in about 6 months' time? Is that right? July, thank you. And Sophie Chipperfield, who you will know, and she's just got a job. But what we need is a couple more, maybe even 3 more people that want to be researchers who will still be students throughout the duration of this time. And there's a really important reason for that. Firstly, because one of my ambitions for this is to promote an exchange and a solidarity between people who are coming up to qualification and people who have done, but also is part of what the university is excited about, this research, because it's involving students. So I want people who are going to be students still when the research finishes. You don't have to have done any research before. You don't have to know how to do research already. You do have to be interested. You will be conducting some research interviews and getting some help to do that, probably 2 or 3, and transcribing them also. You will need to be interested in critical ideas, but I'm going to be helping you to get access to some great reading material that you'll really enjoy, you'll really expand your horizons, you'll find really interesting. And my kind of promise to those who are in this research group is that by the time you're applying for your 2nd job, you will be published in a peer-reviewed journal, a great piece of research. And in fact, I already have a journal that's interested, even though we haven't written anything yet. Okay, that's my you're volunteering your time, but that's my promise to you. We also need more participants, so people who are coming up to qualifying now, who will be staying in touch with us even as they lose their BCU email address, and going off to work in this local trust, and would be willing to be interviewed in 6 months' time after they've finished. We need you as well, and we want to include you, and your views and your experiences are really important to capture this moment of what it is like to be a psychiatric nurse at this time, and a newly qualified one. And you'll have a chance also to meet others and to gain some solidarity in your experiences that you take in and that you learn on the wards or whatever other clinical areas you're going to. Are there any questions? I've just gone blah, 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 blah. Are there any questions? No? Sound good to you? I'm really excited by it. We've started doing, I'm doing all the hard work for applying for the ethics stuff. So that's, I'm showing everyone what I'm doing, but you don't need to worry about all that boring stuff. I'm doing that. The university love this idea. They're fully behind it. And we've started doing a literature review together, finding out if there's anything else like this been done, and what kind of angles that took. That's really interesting. It's interesting for what it is coming up with and what it isn't, which is what I expected. And so far, we're having a great time. You need to write down my email address, which is how you're going to tell me that you really want to be either a participant in the research or part of this research. I can tell you that there is a gender mix of the 5 of us, but we are all white. If you think that's okay, fine. If you don't, and you feel you're in a position to do something about that, then please, like everyone else, feel welcome to put yourself forward. My email address is Jonathan, Jonathan, .Gadsby, Gadsby, like Gatsby, but with a D, at mail.bcu.ac.uk. Any questions? I really look forward to meeting those of you who I haven't met. That's if Andy invites me back for another module. I really look forward to meeting you, and great to see so many that I have met again today. Thank you.